So just to say you are all very welcome to this evening's webinar, which is entitled Championing Mental Health at Work for Occupational Therapists. And this webinar is organised by COTEC, the Council of Occupational Therapists for the European countries. And we do this proudly in support of European Public Health Week. So European Public Health Week takes place this week, the 12th to the 16th of May. The theme for this year's week is Innovation for Resilience, Shaping a Sustainable Future. And for more information, you can check out the website of the European Public Health Association. So as part of our webinar today, we have two presentations, but we also want to introduce Monica Brinzak from EUPHW, who are organising European Public Health Week. And so we'll go over to Monica just for a brief introduction, and thank you.
Thank you so much, Áine, for the invitation. Thank you so much for COTEC for the work that you are doing. We are not officially partners yet, but we are working very much towards that because we are very interested in this connection, and we think that occupational therapists are very important to public health, and not only. I am here in my position as network coordinator, the position from which I am coordinating the European Public Health Week this year. And I'm very grateful to say that this year has been a record year. This year, 326 events were submitted for the week. So many events, which I was amazed, I was surprised, and it shows the interest that people have in public health, and it shows that public health might be more relevant now than ever, regardless of the tendencies that we're seeing at European or global level from the politician side. It is a sign that we need to be united. It's a sign that we should work together, and it's a sign that we should fight for public health. Thank you so much for joining today's webinar. Each day for the European Public Health Week, I've put the link in the chat. Each day has the topic. Today's topic is mental health, putting the health workforce at the center. So we are very much working towards that. And I would say that a fifth of the events were submitted for today. It was a very big interest for today's topic. It shows that people are very much interested into the topic, and we just finished the event that we hosted in the European Parliament, which we had a very interesting approach, array of people ranging from NATO that are starting to be more and more interested into health and health security, ECDC, DG Santé, DG HERA, MEPs that we discussed about health. So we are trying to bring people together under the umbrella of the European Public Health Week to discuss health, to create more awareness about public health, and to show that it is very relevant and more funding should be given. And speaking of the workforce, despite of the fact that oftentimes disregarded, occupational therapists are a very important part of the workforce, of the health workforce. It is very relevant for people to be seeing occupational therapists, and to be not only for occupational therapists to be considered as integral part of the workforce. I admire very much Áine and COTEC in general for the work, for the tireless work that you're doing to put and to shed light on occupational therapists. Thank you so much for joining me, for inviting me, and have a great day ahead. Thank you.
Brilliant. Thank you so much, Monica. That was wonderful to get that background. I want to thank again everyone for joining us. It's just so important to create space for talking about our mental health as occupational therapists, and as you say, the healthcare workforce in particular. We're always advocating for health and well-being through occupation. Sometimes we need to practice what we preach to our clients a little bit more. So it's important to take that time to really think about it. So thank you, Monica. And so without further ado, we're going to start our presentations. Our first presenter comes all the way from the University of Newcastle in Australia. Her name is Dr. Samantha Ashby. She's an associate professor in occupational therapy there. Now it's 2 a.m. out in Australia, so we weren't cruel enough to ask her to get up to deliver the presentation live. So it's a pre-record. I hope that's okay with everyone. But Samantha's someone who's highly skilled in the area of research and practice to do with exploring professional resilience for occupational therapists. And being one herself, I think, is really important. So we'll start off with Samantha's presentation. Thank
you. And I'd like to thank the organisers of Championing Mental Health at Work for Occupational Therapists webinar for inviting me to speak today. So my name is Samantha Ashby and I work at the University of Newcastle. I've just realised, which is in the bottom corner of Australia, north of Sydney. My research is focused on exploring professional research strategies, and I'd like to share this with everybody today to give you some ideas on your own personal resilience and how you can hopefully add to it and share your contributions and how you do this to other people and to colleagues. So first of all, because I'm in Australia, I'd like to acknowledge that I'm presenting on the lands of the Awabakal people, which is unceded Indigenous lands, and I acknowledge elders past, present and future. First of all, I'd like to thank Finn Samnick, who was a social worker who back in 2009 really coined the phrase professional resilience to mean the professional resilience that requires you as a practitioner to find some strategies to cope with occupational stresses and life challenges, and which foster your professional identity and values and make your career sustainable. I then came across this definition in my research, and that's why the aim of my research since really 2013 onwards has been to kind of explore the factors and strategies that shape the professional resilience of occupational therapists. And today I'm going to be presenting from really these two papers, one in 2013 and a later one due to delays with COVID from 2025, and we have another one in press at the moment as well. So from my PhD studies, when I looked at and spoke to experienced mental health practitioners, one of the things I developed was the priority model, and that's described in more detail in that 2013 paper. I've left a contact number, so if email, sorry, so if you want to contact me, you can. The priority model is really to emphasize that professional resilience and occupation-based practice and professional identity are really interlinked for occupational therapists. And for other professionals, it's really around whatever your core paradigm is for your profession. So for nursing, it might be caring opportunities. For social workers, it might be opportunities to work on a family dynamic systems approach. So for occupational therapists, professional resilience is really essential if OTs are to respond to occupational stresses and challenges to their professional autonomy and values. And career sustainability is ensured if an occupational perspective of health and professional identity are valued. This speaks to my own experiences also, because I've been an OT since occupational therapist, since 1987. And I've seen colleagues really struggling with some of these elements that I'm going to talk about today. And I've personally struggled with those in practice as well. So for professional identity, I've done some studies on this as well, and so has some other great OTs around the, particularly in Australia, Kim Wilders from Griffiths and Justin Scanlon from Sydney Uni. It's really supported by valuing occupational therapy philosophy and the use of occupation focus models. So for example, it's the Canadian model of occupational participation, CAWA, and the model of human occupation. There's some examples of those models. Professional identity originates pre-programmed for a lot of people. We identify as being an OT, or we're kind of recruited into the profession by other people who say, oh, I think you'll be a great occupational therapist. And then it's developed obviously through our entry-level programs. And it's based on the confidence in the use of occupation in practice and a belief in the role of occupational therapy in recovery. So occupation-based practice is explicitly what other people see. And that means that as an OT, we want to be using occupation in practical actions, in our assessments, in our interventions, and also in our evaluation of whether our consumers have gained the occupational participation that they were aiming for. And it's underpinned, so the bottom of the iceberg is really all the theory that goes into supporting those actions. And as I said before, occupation focus models play a big part in that, keeping us occupation focused and guiding and providing theoretical frameworks to understand occupational issues. So kind of from my research, what I found is that it doesn't matter too much about which of the occupation focus models you're using, as long as you're using something that keeps you guided to its use, because we as OTs, we tend to treat what we assess. And so if we've not got a top-down occupational focus, then we can very easily end up being not using occupation and being quite focused on performance components instead. This is a image of the priority model, and it's supposed to illustrate the fact that it's like this is that professional identity and occupation-based practice are integral to professional resilience, and that occupation-based practice is underpinned by evidence-based skills and practical approaches, that professional resilience allows us to be adaptable and cope with challenges and hopefully encourages career sustainability, and that professional identity is based on values, beliefs, professional purpose and self-concepts. So within occupational therapy, one of the big pressures that I've identified, but also Claire Wilding and Whiteford and other people, other authors as well, is that there's a big pressure on our occupational perspectives of health because of dominant discourses in the workplace. Now, if we work in hospitals or in medical teams, then that's often a focus on biomedical discourses around symptom reduction, rather than looking at people's occupational issues and participation. And in mental health, it can be that those areas of workplaces are dominated by psychological theories, and psychological therapies are more valued than doing everyday tasks with people. And that's why it's so important that we have this professional identity where we can see the value in occupation. So also other just general occupational stresses, which are common to many other professions, is that idea that we're often in outcome-driven health settings, that we experience stress and job dissatisfaction for a number of reasons. And various authors have identified that burnout impacts on professional identity, and professional identity loss impacts on burnout. This is an image from the Occupational Therapy Board of Australia. They, very similar to your own country, monitor the number of people who are registered as OTs. And what you can see is that there is a drop-off in the population of occupational therapists over time. And what that means is that the implications of the loss of experienced practitioners from the workforce, which is generic to all professions, is that we lose that knowledge, that wisdom and corporate knowledge of how to do things better. If we don't have enough people and enough experienced people, it can put constraints on the quality of services. It also adds to employers' financial costs for recruitment and training, can lead to decreased morale amongst other people who are left. And it's also, really importantly, a loss of supervisors, but also mentors within the profession. So we want to do everything we can to better understand what other people are using to keep them in the wonderful career that is occupational therapy. So my next study that was published in 2025 was an online questionnaire. Had 39 questions with 4 different categories that looked at professional resilience strategies in yellow, but also looked at supervision and mentoring in some detail as well. The inclusion criteria was that people had worked for more than 2 years, and that they had to be able to understand our survey in English because we didn't have translation services. So thanks to the 495 respondents from 29 countries that completed the questionnaire for me and my team, and from Australia, from UK and US and Canada and New Zealand were the biggest components, and the other countries that responded. The demographics were about 10% male identifying, and the others were female identifying, which is about right for registration in Australia and around the world. Years of experience, 51% had less than 10 years, but 21% had more than 21 years experience. So well done us, who have all been qualified for more than 21 years, and thanks for filling in the questionnaire. Of the people, 20% were the only OT working in their team, and 80% worked in multidisciplinary teams. So of the participants, within their career, 50% said that they had considered leaving occupational therapy for the reasons listed below. I won't go through each of them because of time, but the biggest ones were really workplace related and dissatisfaction with OT practice, and that loss of professional identity made up a great deal of other areas. And there were multiple other reasons there, but they were the biggest ones. So workplace related challenges. So I did ask about stresses in the workplace, and it was quite similar to other studies that you will have looked at maybe, where people investing too much time and energy into roles was a big problem. There was a lack of OTs in the workplace, and there was pressure to work outside of domains. People felt that they couldn't control workloads. They weren't really able to maintain a work-life balance was another big problem. And the fact that the roles weren't understood was a problem for some people, but not everybody. This is what I want to really focus on for the second part of this, which is the top 7 professional resilience strategies. Now, this is not an endless thing here, and you'll see that it's not really reflecting on anything to do with some of that personal resilience. It's more to do with professional things. So, because that's what I'm interested in. So that belief in the value of occupational therapy kept people working even despite difficult situations. That opportunity to reflect on positive outcomes when things were hard. Personal time management strategies that we can share with our junior colleagues in how to manage diaries, how to block out time, how not to do difficult home visits on Friday afternoons, and those kind of really practical strategies that we can share with others. The importance of informal and formal support networks is something that I'll talk on in a moment, that employers can definitely add into their planning. And pursuing career building opportunities, so CPD, that's continuing professional development courses, attending conferences, and being with other OTs was really important in that. So that's kind of another formal opportunity to network with others. And then the more personal things, regularly utilizing breaks and vacations was really important. And supervision was identified as important by 63% of people, but 21% had not accessed supervision in this particular survey, which is worrying for more senior OTs. So implications for your practice. So over on the personal columns in grey, it's really important that we are able to maintain clear boundaries, have a clear sense of our role and responsibility so we can say no more often. OTs are often saying yes to working outside of professional domains, and that idea of remaining constantly updated with evidence-based practice to support occupation-based practice. So really looking at the research that is reinforcing our professional belief in and valuing of occupation. And as we know, that's really an increasing focus of most of the occupational therapy journals. Also, really, really important to recognise that, and I'll talk about this in a moment as well in more detail, leaving a job and resigning from a job that is not bringing you joy after you've tried everything is a really good way of maintaining career longevity. And that is where it's quite important to organise a mentor, because mentors will give you that advice. You've tried everything, it might be time to leave. And certainly that has kept me in the profession when I've not enjoyed something, or I haven't found a match with what, particularly earlier on in my career, where it didn't match what I really wanted to be doing. It's a good idea to look for something else, because OT, we have such a breadth of opportunities that you don't need to stay in a particular job if it's not enjoyable, because that will lead to your burnout. So one of the top things was leaving a job, getting those time management skills and going on courses for those. And as I said before, using breaks and organising mentors. So what can our workplaces be doing? And if you are an OT manager, what can we be doing? Well, one of the things is that formal and informal supervision and networking meetings are really crucial to occupational therapists. We are very friendly and we like to be together. So even if you organise a monthly OT meeting where your team can come together and you do informal CPD, or you do journal clubs, or those kind of things are really important. And the other thing is to stay in contact, as we all do, with our peers. My 1987 graduating team are meeting next Saturday in London. I can't be there, but because we all stick together, and we've got a WhatsApp group. So WhatsApp and those kind of things now really allow us to stay in touch with our peers. Acknowledgement from colleagues and management, making sure if you are a manager of a team that you are making sure everyone feels valued. And if people are not feeling valued, making sure that you're really aware of that, and making sure that everybody gets to focus on the positive outcomes for clients and their contribution, and providing access to professional development opportunities. And that can be things like for our junior staff, it could be shadowing someone else who's more experienced for a period of time. It doesn't have to always be very expensive. Entry-level program educators around who might be listening. I didn't really include this, but it's really important to include professional resilience in our curriculum, ensuring you teach strategies that enhance resilience, and preparing our new graduates for the fact that we do have that unique occupational health perspective, that we are really engaged in something that might be quite different to other people and colleagues, and that we do have to then often advocate for occupation-based practice, and having a really strong focus on professional identity and domains of practice in our curricula, and emphasize the importance of supervision when we're advising people on first jobs, and the fact that joining professional organisations allows for that formal support. Professional socialisation, I was speaking about before, forming or joining existing communities of practice. Always go, even if you're too busy, because it is the thing that tops up our joy and our resilience. It's a protective factor for professional resilience. Join in professional organisations. So in Australia, it's the OT Australia. In the UK, it's the Royal College of OTs, and everybody will have their similar peak body organisation. Attend or set up monthly in-service meetings if you're a senior, and if you're junior, go along and socialise informally with your OT colleagues and university friends. Supervision is really important for everybody. Doesn't matter how senior you are, you should be getting some form of supervision, or you could look for a mentor if you find that a more appropriate opportunity. But supervision, effective supervision, provides opportunities to reflect on positive outcomes, to discuss cases, but also to seek advice on how to better implement occupation-based practice, because it's easy to get stuck in a particular way of doing things. And also, supervision is really good for less experienced staff to really be able to sit with you, or you sit with others, to explain the theoretical knowledge that you're using, because that helps you then to explain our practice to other people and colleagues and to our consumers. So seek good, regular supervision that really you feel supports occupation-focused practice. And if you can't find someone in your organisation, try and find an effective super who can actually assist you to articulate your use of theoretical knowledge. And some, as an extra thing, find a mentor who sits outside of your organization who can advise you to do the next few things. So one of the things is, this is a great quote from one of my participants. I think the medical model is the opposite to an occupational perspective. It reinforces that medication is the most important thing. Without that, everything falls down. But I've seen some really unwell people continue to live in the community, but I haven't seen well people living without living skills survive very long. And that's from a mental health OT. And that's that importance of negotiating and having confidence in our occupational perspective. Now, that comes from experience, but it also comes from accessing evidence-based practice literature, asking colleagues and supervisors for strategies. And if one of the really good things is, if people ask you about your role as an occupational therapist, absolutely explain it to them, but ask them to also explain their role in the service as well, because then you can see whether it's a genuine kind of questioning or whether it's kind of something a little bit different. So that's one of my strategies that I would always use. One of the most important things is, and this is where you might get this from mentors, that everybody who is experienced, and if you think back, if you are an experienced OT, knowing when it's time to go, it sounds like a country and western song, and it's because it is from the title of that knowing when it's time to leave a job where you're not getting validation by team or managers and there's no opportunity to change it, that you're not in a powerful position, and so you need to leave. And there's no match between valued occupation-focused knowledge and its use in practice. And if you have no opportunities for effective supervision, then you need to reflect and seek support from managers and colleagues to leave. Okay, so thank you for your attention today. And if you've got any questions, I'm sorry I couldn't be there because of the time differences, but please feel free to send me an email and I can either send you, answer any questions you might have, or I can assist you in finding those articles that might be helpful for you. I hope you found that helpful. Gone through it quite quickly, so I hope that's all been helpful and that you can reflect on those slides and in particular try and implement some of these strategies that I've shared from our colleagues. And thanks to all the OTs that have been involved in my research up until now, and good luck and thank you for your time.
Brilliant. Our thanks again to Samantha for that wonderful presentation. We're going to jump right to the next speaker. So we have time for a discussion at the end because there's lots of food for thought even from that first presentation. Our next speaker is Dr. Áine O'Dea. Áine is the founder and CEO of Radiance Consulting, which is based here in Ireland. Áine has a wealth of experience in many areas, including occupational therapy practice, population health, coaching and clinical supervision, and in her current role supports leadership and allied health in addition to acknowledging and confirming neuro-affirming workspaces. So Áine's presentation, Áine, do you want to upload it there?
I will indeed, thank you.
We're delighted to have Áine as well.
Super, thank you so much, Anne-Marie, thank you. Do you want me to jump in? So I'm going to talk to you this afternoon about, yes, champion mental health at work for occupational therapists, but really taking a neuro-affirmative lens with regard to this. So as Anne-Marie said, I'm based in Ireland. Down here near Limerick, you can see the tiny little symbol there for the airport, and Limerick is not far from there. And these are my two kids, and my partner is never in the photos, so he unfortunately didn't make it. But we live near the River Shannon, and I live very close to Limerick City, so this is a nice walking spot for us. My background is very diverse. Yes, I'm an occupational therapist, as I always say, but I've done lots and lots of other pieces. But I think for me, as I listened to Samantha's presentation there, occupation has always been the central hub that has held my professional identity. So obviously I've gone on and done a master's. As Anne-Marie said, I have a PhD in population health and health services research. I've completed a postgraduate in clinical supervision and would have contributed to this book here on supervision for OT, which was published by Karina Danzak and colleagues. And it was the first book looking at supervision specifically for the OT profession and the lenses that we come to it. I'm also an occupational performance coach trainer as part of that network, and that was developed by Dr. Fiona Graham. Some of you might be familiar with her work. But a lot, and I suppose then I've also done as well, I've completed a postgraduate in business and executive coaching, because many people that I work with will work in leadership roles, both in the public and private sector. So how do we think of health as a business? And because it's health economics. So a lot of what I do now, the services that I offer are coaching. I very much take a neuroscience or a scientific based approach, given our training that we have with regard to all of those science that we have, and then we put the art with it. So for me, taking a neuro lens to coaching is just very natural, because we know the science and then we apply it to that piece around our professional theory, as Samantha said. What is our lens? So for me, that's always nearly around people, environment, occupations, barriers and facilitators that they experience in their personal and professional lives. And I bring that into the workplace in a lot of workplace wellbeing events that I will present at with regard to talking about neurodiversity in the workplace. So the next event that I will be talking at is actually at the Irish Hotels Federation conference. And they are looking at how do we support our workforce, because that is their biggest commodity, is their workforce. How do they support them? Knowing that there is cognitive diversity across the workforce, but that actually people don't necessarily need to identify as being neurodivergent. And then also, obviously, a significant proportion of my work is working with allied health professionals. And again, I provide a lot of supervision or coaching for them. And what's really interesting that I find as we start to move into more of the theory slides now is when I go and I look at what's the research around the prevalence of neurodiversity for the allied health professions, it is extremely difficult to get robust data. We just don't see it. But yet when I talk to clinicians in practice, neurodivergency is part and parcel of our professional lives, our professional identity. Often we work with neurodivergent individuals and clients, but also we are neurodivergent individuals ourselves as well. So we have a neurodiverse workforce. I'm dyslexic. I more than likely would think that I'm also ADHD. It's probably a bit of a given when you look at my hyper-focused or my special interest in academic study. I love it and it's always been a strength, but we don't look at that in terms of our health professionals and how we support them in the workplace then. I've just realised that one of the things I jumped straight in was, as you can see here, the spelling of my name, Áine, can be quite difficult to pronounce because it's an Irish name, and that's how it's pronounced, Áine. So when we think about then supporting neuroaffirmative workplaces, we want to look at employee well-being and job satisfaction. The research tells us consistently that employees who perceive a lack of support for work-life balance may experience heightened levels of stress, fatigue, and dissatisfaction with their jobs. So when we think about being neuroaffirmative, we really want to look at, okay, how are people managing this piece around their work-life balance? That's a key indicating factor for people. Work-life balance then is defined as, it's something that's self-defined, and it's a self-determined state of well-being that a person can reach or that we can set as a goal, and that allows the person to manage effectively multiple responsibilities at work, at home, and in their community. Work-life balance supports physical, emotional, family, and community health, and it does so without grief, stress, or negative impact. So now when you think around the multiple demands, placed on individuals in the workplace, we look and say, okay, how neuroaffirmative is our approach towards work and towards really enhancing work-life balance? Do we put in policies and create a culture that supports this to sustain people in the workforce? We see that individuals' perceptions that work and non-work related activities, they need to be compatible. They need to promote growth in accordance with an individual's current life and priorities. In addition, it needs to, because work-life balance is such a multi-dimensional construct, it needs to look at individual factors, societal factors, and organizational factors, which obviously includes time management, the administrative paperwork that goes on in our jobs, our psychological well-being, social supports, and workplace benefits. Now, that is really important when we start to think about neuroaffirmative practice, because if we think of neuroaffirmative practice as cognitive diversity, we all have different thinking styles and different styles of processing information, both from our sensory, our psychological, our cognitive styles. So when you think about that then, and if we all have different styles of thinking and processing information, how does work support that? Does work support that actually time management will be well facilitated, administrative paperwork will be, our psychological well-being, our social support and work benefits? And this is where, when you look at the gap in the research around, okay, what does it tell us how we support neurodivergent individuals? And as occupational therapists, we know this, but sometimes we don't apply that same information to ourselves as a workforce. So we often work in public health systems where the administrative burden is really, really high. We're not working with administrative systems that are highly efficient, robust, cutting edge technology. We're usually at the latter end of that, at the administrative side, of where actually technology may not be at the leading edge of integrating new AI systems, so that actually it reduces the amount of time on operational issues, time management. So these are all the factors that we would support, or I would see where I do a lot of support, like looking at for areas for like the hotel industry or for engineering or for health. And yet for our own workforce, many of the strategies that we use to support neurodivergent individuals are not applied to us as a workforce. And given that neurodiversity is part and parcel of everyday life, we need to start to think about how are we creating a neuro-affirming culture within our own professional practices, especially if the literature isn't there highlighting this, and how do we start to research it? It's probably even more important, I think, based on Samantha's previous presentation and taking these findings around burnout. So we see the risk of burnout across allied health professions, and looking at that data within the occupational therapy profession, it's really high. So on average, about 70% of occupational therapists will experience burnout at some point in their career. So if that was a ticket that you could buy and you were going to win a prize, you would think, oh my gosh, the odds are so high here, 70%. I'll buy lots of tickets because I'll definitely win. So when you think about it, in the workforce, you buy lots of tickets every day of the week. You are constantly there, you show up. So the chance of you experiencing burnout is really high. So like what Samantha said, we now need to look at, well, how do we protect our workforce? And also recognizing that neurodivergent individuals and workers may need additional protection, to support our long-term health and well-being, that we don't burn out sooner. So what do we mean by burnout then? What we mean is that actually it's characterized by feeling emotionally depleted or drained, and that this can result over a period of long-term work-related stress. So I'm sure many of you are listening to this going, feeling emotionally depleted. Has that happened to me recently? If I talk for myself, I'm like, yeah, it happens on a regular basis. I work for myself, I run my own business, so I love it. But there's times of where I'm emotionally exhausted also. So I need to know, how do I mind myself as a worker and also within an organisation? So that feeling of personal energy when it's gone or low, how do we recognise the signs of emotional exhaustion? How do we recognise the signs of depersonalisation or cynicism? When do we start to detach from our work? When do we feel that loss of motivation or interest? And when do we have feelings of inefficacy? So feeling helpless or hopeless about work, and that sense of a failure, that we don't reach our personal work-related goals. These are certainly factors that I would see that show up a lot in supervision and a lot in coaching sessions. One of the tools that I'll often encourage people to use is either the MBI, which is Maslow's Burnout Inventory. And this is a well-established burnout checklist. It's a questionnaire that you can use that assesses across those 3 criteria. And that's a really nice way of actually screening, where am I with regard to my own levels of burnout, knowing it. The Copenhagen Burnout Inventory is also a really nice tool that's freely accessible. And this is a tool that is often encouraged to use with neurodivergent individuals. So you can see here, Embrace Autism use this tool to support neurodivergent individuals, so people who are autistic, ADHD, dyspraxic, to actually look at where is my own levels of burnout with regard to personal burnout, maybe work-related burnout or client-related burnout. So it's often described as a really good measure for autistic burnout, especially under the subscale of personal exhaustion. So when we think about, if you're supervising an individual who says to you, yes, I am autistic, yes, I'm an ADHD, or I'm dyslexic, I'm dyspraxic, encouraging them to actually be able to identify this themselves, so that at a personal level, we've got that knowledge, awareness, and understanding of our own needs. Now, it is not to say that all the responsibility is back on the individual level. We need to be flipping this, that we're creating neuro-affirmative workplaces. And by that then, we want people to start to reflecting on my work-life balance journey. Like, yes, how am I feeling today? How am I thinking? And how am I behaving? Am I displaying or showing personal signs of burnout? And recognizing that, so that actually we can then start to communicate that to ourselves, and also communicate it within our organizational structures, to line managers, to others, to advocate for what are our needs that we want. Because when you think of other workforces, there has been a real, especially I think in Europe, progression towards looking at neuro-affirmative policies, neuro-inclusion in the workplace. But one of the places where we hear this the least amount is actually in health. So I will hear this more in accounting, engineering, the tech industry, the hotel industry. But it's very rare that the health industry approaches me and says, will you do a talk on neurodiversity in the workplace? So we potentially need a bottom-up movement of where actually, as the workforce, we need to actually advocate for ourselves and for our colleagues, that when we supervise people, asking them those questions, knowing the tools at our disposal, like what Samantha said, what we assess is what we treat. So if we assess and we recognise personal burnout, we recognise work-related burnout, and we recognise emotional exhaustion, now as supervisors, as colleagues, as mentors, as managers, as advocates, we can advocate at a policy level and at an organisational level for our own workforce. So I suppose thinking about then, this is from the Mental Health Association, and they often look at, when we're thinking about for ourselves, what are the demands on us? And if there's too much going in every day into that stress container, what can we cope with? As OTs, we know this so well. We constantly help our clients to look at this. But do we look at it ourselves in the workplace? Is this environment really conducive to my neuro requirements. The fact that actually maybe at a sensory level I hate noise, or actually it leaves me feeling really dysregulated. Yet as health workforces, we're often now in open plan offices, hot desking, shared spaces. So this opportunity for sensory friendly environments is not applied in our world at all. We're often rushed between appointments. So when we think about interoception and recognizing our own internal body states, often within the workforce, we don't actually even recognize, or we're trained and culturally nearly, I don't want to say, but there's nearly like a culture shift to keep going, keep moving, keep doing. So we forget the basics of tuning into our body to go, I need to use the bathroom. I need a toilet break. I need my lunch on time. Whereas we keep going and then we get to point in the day going, gosh, I haven't used the toilet yet. Oh, I'm actually really hungry. So we talk to others about their interoceptive needs and supporting regulation. But sometimes we're not attuned to our own. So looking at that container of stress that drips in, and how does that impact our regulatory capacity? So we want to recognize that burnout is multifaceted and its impacts are really, really significant. So it impacts at multiple levels. At the individual level, we see chronic health issues, we see fatigue, we see substance abuse, and we see that we're more accident prone. And this is definitely something that I would see that comes up in supervision, where OTs will say to me, yeah, I bumped into something the other day, or I was getting out of the car, or that piece of equipment, I actually got hit by it. But actually we brush it off and we laugh at it and we think, oh, this is me, versus actually thinking that, is this the work, the impact of the work on me, and that actually the demands are too high and that I'm not supported in the workplace to deal with them. We also see the cognitive emotional level. We see the social familial level. There can be a real impact on people's personal relationships and increased family problems. And when we think about that, who gets the brunt of it? Our loved ones. We often talk to, our clients who are supporting neurodivergent children, or family members that, when they're in their safe space, in that really safe environment that's often home, that is where the dysregulation is most apparent. Or where, we're thinking about it maybe for our client, they've, regulated all day at school or in work, and then they come home and actually the dysregulation is really apparent. And it's that piece of stepping back on, how does that apply to me as an occupational therapist, and as a health worker? Do I display similar patterns? We see the impact of it on an organisational level. We see absenteeism, higher staff turnover, reduced service quality. So when we think about when we're supporting neurodivergent children and adolescents in the school setting, we see the research around school avoidance. We see the research around protecting their mental health at an organisational level within schools, but yet that's not applied to us as an OT profession at an organisational level. So we don't look at absenteeism and think avoidance of a stressful environment, and yet that's what maybe we're paralleling here. There's also public and social health impacts as well. There's rising concern for professionals given the significant socioeconomic costs. It is really costly. The NHS have looked at this for their workforce. The longer people are out of work, or the more sick days that they take, it costs millions to health organisations per year. So I suppose often where I support people to look at creating neuro-affirmative workplace and practices, I'll often start with supervision. And I'll start with encouraging people to look at, a core objective of supervision is to provide emotional support and to help supervisees to enhance their knowledge, skills and capabilities, not just about their clients, but also about their own professional practice. So that then, of course, we'll always keep that piece there of ensuring professional organisation standards are met. But providing emotional support is that piece around how do we provide neuro-affirmative support to our supervisee or to the employee, the OT, to recognise this workplace may not meet your neuro style. Your neuro style may be completely at odds with the workplace where you are. So then we want to think about how do we shift that dial a bit and help people to think about a neuro-affirmative workplace that will support them. So we want them to think about, okay, work-life integration. Are people feeling overburdened in work? Is my personality type, is one of my core strengths that actually I am detail focused, that I am. So actually, by focusing on the detail, does that mean that I overwork, that I stay longer to ensure that I've finished all of my documentation? So getting people to think, rather than like this piece around the deficits, we want to flip it completely and think of the strengths that we bring, but are we overusing our strength? Thinking as well around work-life integration, around that piece as well that links then naturally into social support and community. What are the social structures in the workplace that support me in the community? So like Samantha said, sometimes the first thing to go is networks, professional development opportunities, which are all social support. So we want to think about how those actually help to really enhance neuro-affirmative workplace of my professional identity. But we also want to think about how we access it, because for what's a neuro-affirmative network opportunity for one person may not be the same for somebody else. So am I somebody that needs to think about accessing professional development support via an online journal club, or via something that actually is more of a hybrid, that I don't need to think about increased social demand? So how do we tweak and help our employees to look at the types of social support and the communities that will be most supportive to them? And we also want to think about their personal well-being and development, because sometimes in health we're not thinking about that piece of the neuro-affirmative practice side of it. So we want to really tap into, what's my neuro style? Does my environment match it? How can I advocate for myself? If I was in any other organisation, I would be thinking about reasonable adjustments, about talking to my employer. So how do we take that knowledge that we know for others and apply it to ourselves, so that then we can enhance our professional practice and our professional identity? I'm really conscious of time. It is 5:25 already. So I'm going to stop there after that real whistle stop tour and back to you, Anne-Marie.
Thank you so much, Áine. It was kind of like Samantha kind of raised the issue and you actually had the strategies around how to tackle burnout, etc. So it was absolutely a brilliant add-on.